In October, we observe as Breast Cancer Awareness Month. So there are a few questions we would like to ask. What is breast cancer screening and why it is important?
So, screening is checking for a disease before it actually makes symptoms or it becomes evident in your body. Okay. So, we can screen for breast cancer, cervical cancer, oral cancer, broadly speaking. We can screen for other cancers as well. Breast cancer is the most common cancer affecting women in our country right now. So, how do we screen for breast cancer? So, the most useful and the best way to do it is by mammogram. So we ask women above the age of 40 to do yearly mammogram. If at all that's not possible or feasible, India being a huge country and mammogram availability, accessibility is very limited, at least the least they can do is do self breast examination monthly. Is that means checking your breast every month to see whether they can feel any difference in what was there last month than this month, any lump in the breast or anything abnormal which was not there before. So that is basically screening for breast cancer.
So can we tell that through screening we can prevent breast cancer?
Okay, so we cannot really prevent breast cancer. We cannot prevent it. Like in cervical cancer, we can give the vaccine, and we can, to some length, we can prevent the disease. But here in breast cancer, we cannot prevent getting breast cancer, but we can catch the disease very early, and that helps in the treatment of the disease. So once we catch the disease very early, the treatment is much easier. The lump is much smaller because it has not still become very evident. It is not a 4 centimeter lump. It might be 1 centimeter or 2 centimeter lump. So the treatment of it is much easier. Many a times patient might not require chemotherapy. Most of them are scared of the only thing, which is chemotherapy, losing their hair and the nails getting spoiled, and that's a very long and expensive treatment. So I would say we cannot prevent the disease, but yes, the treatment is much smaller and easier if we catch it early.
So is that related to like can we cure this if it is detected early?
See, in a very early stage 1 disease, if we treat properly with proper protocols, the chances of it coming back, the disease coming back, we are always scared कि cancer है तो फिर से आ सकता है, it can come back again. The chances increase of coming back once the stage increases. Okay, so a stage 1 breast cancer has less chance of coming back than a stage 3 breast cancer. Okay, so I cannot say कि we cannot cure you of the disease, but yes, we can treat you completely and you will be disease free. And once your stage is early, the chances of it coming back is much lower.
Okay.
I think.
Yes, that's helps. Next is what are the warning signs? How a woman, even after doing regular breast screening or self examination, may not understand that the warning signs of breast cancer. So, is there something they can particularly look into it?
So, see, you're doing a yearly mammogram, right? But what about the rest of the year? You're not doing anything about it. So, as I told you, self breast examination is very important. So, what are you checking for when you're doing self breast examination? You're checking for anything abnormal in your breast. Like most of the women, they have a fear and they come to our clinic with complaints of breast pain. Usually, breast pain is not related to breast cancer. Okay, breast cancer has a painless lump, like there is something hard in your breast and it is not associated with pain. So if a woman feels something like that, please come and visit. Do not ignore it. There is no pain. Let the pain come. Let it become bigger. Let it cause a problem to us. If it is not causing a problem, that does not mean you ignore it. Please come and show. Please go and show it to somebody. Any abnormal nipple discharge can be related to breast cancer. Any wrinkling appearance of the skin of the breast, dimpling. You're not supposed to have dimples on your breasts. Dimples are supposed to be on your cheek. So if you have a sudden dimpling over your breast, that is a sign, that can be a sign of breast cancer. Okay. When you're doing self breast examination, you are supposed to feel your underarms as well. Okay. So if you feel any lump in your underarms, that also can be a sign of breast cancer. And broadly speaking, these are the most common symptoms of breast cancer. Always, all lumps are not cancerous, but if you feel any of them, if you see any change in your breast which was not there the previous month, you need to visit a doctor about it.
Okay. Thank you. Next is, are younger women gets affected of breast cancer more? Is this a myth or it's a reality?
Oh, it is a reality, because in our country lately we have seen a huge rise in increase of young breast cancer. Girls as young as 30s, in their 30s, are getting breast cancer, and sadly they are more aggressive form of breast cancer. Even though the tumor is small, so a breast cancer we also define by biology of the tumor, like what type of cancer it is, what type of what is the identity of the tumor. Okay, so they have a more aggressive biology. Okay, so young girls tend to have that, and that's it means even though we treat you completely, they can come back again. So in our country, we are seeing young girls also getting breast cancer as young as in their 30s. So it is not a myth, it is a reality, and that is like triple negative. It's known as triple negative breast cancer or HER2 positive disease. So it's happening.
Is this happening because of like lifestyle or hereditary?
So, hereditary can be one of the factors. Okay, there are a lot of studies which are going on to look into it, but the numbers are very small. And our country is one of the most common country. It is the one of the most common countries which is having young breast cancer. So, there are a lot of studies which are going on to see what is the cause of young girls getting breast cancer lately. But maybe we'll have a clearer answer in few years.
So, how breastfeeding can help to reduce the risk of breast cancer?
So I think a few months back we celebrated breastfeeding month. So then we had this discussion, we had a talk, and we told them, see, breastfeeding, what happens? They decrease your menstrual cycle, right? So when you're breastfeeding, you don't get your menses, and that decreases your estrogen hormone. Okay, there are two common hormones in our body: estrogen, progesterone. So estrogen is one of the causative factor of breast cancer. So when you are breastfeeding, estrogen hormones dips, and that is how it has shown that it can it can decrease your risk of getting breast cancer. Saying that, it is not that if you've breastfed all your children you cannot get breast cancer. Okay, so not at all. We have seen women who have like 4 children, 5 children, and they have breastfed all of them, and they also get affected by breast cancer. So
Thank you so much. It was really a valuable insight for us. Lastly, I would ask you if you give our audience an overview or a short message on this Breast Cancer Awareness Month.
We just want to say that breast health is very, very important. And now we are coming out and talking about it, which was very unheard of until a few years back. It is very important that we check our breast and we do a yearly mammogram. And if we feel anything abnormal, please visit a doctor. Because as I said, breast cancer, when detected early, can be treated. And the treatment is, even though it's long, but once you come out of it, you have a very good life. So it is very important to get yourself checked and to be very careful. If you feel something, please visit a doctor. Don't be scared of mammograms. Don't be scared of biopsies, because there's a huge fear. If I'll go to the doctor, they'll do a biopsy. Please don't be scared of all that. Don't be scared. If I go and take treatment, I'll have to take chemotherapy. My hair will go. Yes, those things will happen, but obviously it's there will be something good out of it, and the hair will come back. You'll get good hair, and everything is good in the end of it. It is a long treatment, yes, but breast cancer patients do have a very good survival rate. So once the treatment is over, the patients actually do very well. So that's all I think.
Thank you so much.
Thank you, Shilabna.